I was glad to hear that the Premier and the Prime Minister spoke about health care funding for Clinic 554 on Monday. Last October, Clinic 554 announced it would have to close its doors due to the provincial law that prevents out-of-hospital abortions from being covered by Medicare. It is also good to know that the reproductive health care that was on the agenda at the meeting, considering Health Canada's annual report said that the lack of coverage for abortions at Clinic 554 under Medicare remains a concern under the accessibility and comprehensiveness criteria of the Canada Health Act. Can the Premier share the details of his discussion with the Prime Minister about Clinic 554 and reproductive health care access in New Brunswick?
The Honourable Premier.
Thank you for the question, yeah, we discussed a number of items, and in the case of this situation, 554 was discussed as well. We talked about following the Canada Health Act. We talked about the concern over not setting precedents in terms of funding private clinics, and I expressed that our position was clear, that we felt that we were following the Canada Health Act and that we were providing the reasonable access as required, and we hadn't changed a thing since the previous government put this all in place. But I also shared with the Prime Minister some statistics that I think he found quite interesting in relation to how the model has shifted. And what we've seen since the introduction of the abortion pill, we've actually seen the number of medical procedures drop significantly. And so we've seen the increase, however, in the abortion pill go up significantly. So this year it started at about 45% and it's gone up to about 70%. So, Mr. Speaker, I think what we see in the clinic is a change in the requirements, which is reflective of the access that is already available.
Time, Premier. The member for Memberhood Tatama.
Thank you, Mr. Speaker. Access to reproductive health care is important. It is a public health issue, it is a human right, and the lack of access to reproductive health care has negative effects. But Clinic 554 doesn't only offer reproductive health services, it also offers many other important services to marginalized groups in Fredericton, across the province, and throughout the Maritimes. The breadth of services offered by their family practice includes all scopes of medicine, from pediatrics to geriatrics, with focuses on trans, LGBTQ, and HIV care. Visiting the clinic would give the Premier a good idea of the services that it provides and how important they are to the community. Will the Premier join myself and the member from Fredericton South on a tour of Clinic 554 this winter?
The Honourable Premier.
So once again, thank you for the question, and Mr. Speaker, I value the health needs of all citizens of this province, and that's why the mandate of any of our hospitals is to serve all of our people equally and to meet their requirements equally. We believe that we are following the Canada Health Act in that regard, and I would be more than concerned if that was not the case. So I think the opportunity here is certainly to ensure that our public institutions, our public hospitals, and the medical staff that are in them are following and meeting the needs of all citizens in a way that serves not only the Canada Health Act but serves the reality of today's world. So I'd be disappointed to think otherwise, and in fact I don't think otherwise. I believe that they actually are providing the service that's needed, and in any particular case where that's not the case, I would want to know about that, and I'm sure that the Minister of Health would want to know about it as well, because providing the best service to all of the residents of our province is absolutely our goal and our mandate.